Welcome back to the Operating Room Global, the podcast that takes you on journeys into the world of surgery. We're your hosts from TORG.
An organization completely dedicated to raising global operating room standards.
And today, we're diving deep into a field that's revolutionizing surgery. As we know it, minimally invasive surgery.
Or MIS, it's a field that's constantly, evolving, always pushing those boundaries of what's possible.
Right. And before we get started,
Yeah.
I want to remind all of our listeners to subscribe and follow the podcast, for more insightful explorations
Absolutely.
into this really fascinating world. Now imagine this. A surgery performed not through large incisions, but tiny, almost imperceptible cuts.
Yeah.
Faster recovery, less pain, fewer complications.
That's the promise of MIS.
It's not just a promise, though.
Not at all, no. It's a reality for millions of patients
Right.
worldwide. MIS has become the standard of care for many procedures,
Yeah.
and its impact is undeniable.
So what exactly makes MIS so different from traditional open surgery?
I think at its core, MIS is about minimizing trauma. Instead of large incisions, surgeons use special tools like laparoscopes and endoscopes
Right.
inserted through tiny openings to access the surgical field. These instruments are equipped with tiny cameras and highly precise instruments, which allows surgeons to really operate with remarkable accuracy.
It's like operating with a tiny high-definition camera and these, miniature surgical instruments.
Right.
It must require incredible skill and precision.
Absolutely, yeah. And that's why the training for MIS is so rigorous. Surgeons need to develop a whole new set of skills to operate effectively in this minimally invasive environment.
Right. But the benefits seem worth it, right?
Yeah.
Shorter hospital stays, less pain,
Yeah.
quicker return to normal activities. It's a game changer.
It's huge, without a doubt. And the beauty of MIS is that it is constantly evolving. I mean, we're seeing incredible breakthroughs in technology and techniques, pushing the boundaries even further.
Speaking of breakthroughs, I've heard so much about robotic surgery.
Oh, yeah.
How has robotics impacted MIS?
Robotics has been a true game changer in MIS. I mean, systems like the Da Vinci surgical system with its robotic arms and 3D high-definition vision, it allows surgeons to perform complex procedures with even greater precision, dexterity. I mean, imagine a surgeon controlling robotic arms that, mimic their hand movements with incredible accuracy. I mean, that's the power of robotic surgery.
It sounds like something out of a science fiction movie.
It might sound futuristic, but it's a reality in operating rooms around the world.
Wow.
And the benefits are significant. I mean, studies have shown that robotic-assisted MIS can lead to less blood loss, shorter recovery times, and reduced post-operative pain for patients.
That's remarkable. But I imagine there must be a steep learning curve
Oh, for sure.
for surgeons adopting this technology.
Absolutely. Transitioning from traditional open surgery to robotic-assisted MIS requires extensive training and practice. Surgeons need to adapt to operating, with a magnified 3D view, and using robotic controls to manipulate instruments.
It sounds like a whole new way of operating. Speaking of training, I've heard that virtual reality and augmented reality are being used to train surgeons in MIS.
Yes, VR and AR, they're transforming surgical training.
Wow.
These platforms allow surgeons to practice complex procedures in realistic simulated environments,
Wow.
building their confidence and competence before they ever step into a real operating room. It's like having a flight simulator for surgeons, giving them that opportunity to hone their skills in a risk-free setting.
That's incredible. It must make a huge difference in preparing surgeons for the challenges
Oh, yeah.
of MIS.
Absolutely. And the applications of MIS are constantly expanding. We're now seeing minimally invasive techniques being used for increasingly complex procedures, from organ transplants to cancer resections.
So MIS isn't just for simple surgeries anymore.
No.
It's becoming the preferred approach.
Exactly. And we're seeing the development of hybrid approaches, where surgeons combine elements of both open and minimally invasive techniques to tailor the surgery to the specific needs of the patient. It's about finding the best possible approach for each individual case.
It sounds like MIS is not just about the technology.
Right.
It's about a shift in surgical thinking.
I agree.
A commitment to minimizing patient trauma
100%. Yeah.
and maximizing recovery.
Yeah. You're absolutely right. And that focus on patient-centered care, that's really what's driving this continued evolution of MIS.
It's amazing to see how far this field has come
Yeah.
and how it's transforming the surgical experience for patients worldwide. But we also know that MIS isn't without its challenges. right?
Of course, yeah. Like any, revolutionary field, MIS has its hurdles. And one of the most significant challenges is the cost of technology. Implementing advanced technologies like robotics can be a substantial investment, especially for healthcare systems in low and middle income countries.
And beyond the cost of the technology, I imagine training surgeons in these specialized techniques
Yeah.
also requires significant resources.
You're exactly right. Training for MIS is specialized and requires dedicated time and resources. And even after initial training, surgeons need ongoing professional development to stay, abreast of the latest advancements and maintain their
The
skills.
continuous learning process, especially in a field as dynamic as MIS.
Precisely, yeah. And the learning curve can be pretty steep. Surgeons accustomed to traditional open surgery need to adapt to operating with limited tactile feedback, relying on visual cues from the camera, instead of their sense of touch.
It must be so challenging to perform surgery while looking at a screen and relying on these tiny instruments to do the work. It requires a whole new level of hand-eye coordination.
For sure it does. And
Right.
not all hospitals and healthcare facilities, they don't all have the infrastructure and resources to support MIS. Equipping operating rooms with the necessary technology and training staff can be a significant undertaking.
So while the potential of MIS is enormous,
Yeah.
there are practical considerations that
Understand.
need to be addressed
Yeah.
to ensure its benefits are available to everyone.
Absolutely. Making MIS accessible to all patients regardless of their location, socioeconomic status is a crucial goal.
That's a powerful statement. And it highlights the importance of organizations like TOR
Yes,
in advocating for equitable access to surgical care worldwide.
exactly. TOR plays a vital role in raising global operating room standards and promoting the adoption of best practices in MIS. Ensuring that patients everywhere have access to the most advanced and effective surgical care.
It's inspiring to see the work TORG is doing to make a difference in the lives of patients globally. But even with all the advancements, all the benefits,
Yeah,
I imagine there are still some risks and limitations associated with MIS.
of course, yeah. While MIS generally carries fewer risks than open surgery, no surgical procedure is completely risk-free.
Right. And I'm guessing that certain procedures might be more suitable for MIS than others.
You're absolutely right. The complexity of the case, the patient's overall health, and other factors all play a role in determining whether MIS is the right approach. It's about finding the best possible treatment plan for each individual patient,
Yeah.
weighing the benefits and risks carefully.
So it's about personalized medicine,
Exactly.
tailoring the approach to the unique needs
Yes,
of each patient.
precisely. And that's why, open communication between the surgeon and the patient is so crucial. Patients need to be fully informed about the potential risks and benefits of MIS, as well as any alternative treatment options available to them.
Informed consent is paramount
Yeah.
in any medical decision,
Uh-huh.
especially when it comes to surgery.
Absolutely. And that's a responsibility we take very seriously as surgeons.
It's clear that MIS is a rapidly evolving field with incredible potential to transform healthcare.
For sure.
And it's exciting to see how organizations like TOR are working to make its benefits accessible to patients worldwide.
Yeah, it's a field full of possibilities
Right.
and challenges, And we're only just beginning to scratch the surface of what MIS can achieve.
So what does the future hold for MIS? What groundbreaking advancements might we see on the horizon?
Well, we'll dive into those exciting possibilities right after we hear from our sponsor. Welcome back to the Operating Room Global. Before the break, we were just discussing the incredible advancements and the expanding applications of MIS.
Right.
I mean, we're truly on the cusp of a new era in surgery.
It's mind-blowing to think about all the possibilities. You mentioned earlier that MIS is being used for increasingly complex procedures.
Yeah.
What are some examples of these cutting-edge applications?
Well, one area that's particularly exciting is the field of notes.
Okay.
Natural orifice transluminal endoscopic surgery.
Notes.
Yeah.
I remember you touching upon that briefly before. What makes notes so groundbreaking?
So notes involves accessing the surgical site through natural orifices like the mouth, vagina, or rectum,
Wow.
completely eliminating the need for any external incisions.
So no scars.
Potentially even faster recovery times. I mean, imagine a gallbladder removal performed entirely through the mouth.
That's incredible. No incisions at all. It's taking minimally invasive to a whole new level. What are some other advancements pushing the boundaries of MIS?
Another area of innovation is SILS.
Okay.
Single incision laparoscopic surgery.
Mm.
Instead of multiple small incisions, the entire procedure is performed through a single incision, often concealed within the belly button.
So even with laparoscopic surgery, they're finding ways to further minimize scarring and improve the cosmetic outcome.
Exactly. And beyond these surgical techniques, there's a lot of buzz around AI-powered tools.
Oh, really?
In MIS, imagine software that can analyze intraoperative images in real time, helping surgeons identify critical structures or potential complications that they might otherwise miss.
So AI is not just about robots performing surgery. It's also about enhancing the surgeon's capabilities,
Right.
providing them with valuable insights during the procedure.
Precisely. AI can act as a second set of eyes, analyzing data and providing real-time feedback to help surgeons make more informed decisions. It has the potential to revolutionize surgical precision and patient safety.
This all sounds very promising, but with all this advanced technology, are there any concerns about over-reliance on these tools?
Sure.
Could they potentially lead to surgeons becoming too dependent on AI and losing some of their own skills?
That's an important question, and it's something we definitely need to be mindful of as we, integrate AI into surgery. The goal is not to replace the surgeon's expertise,
Right.
but to augment it, providing them with additional information and support to enhance their decision-making.
So it's about finding the right balance, harnessing the power of AI while preserving, the critical thinking and judgment of the surgeon.
Exactly. Ultimately, it's about using technology to improve patient care, not to replace, the human element of surgery.
That brings up another important aspect, the human factor. With all the focus on technology and advancements, are there concerns that the patient might feel lost in the equation, becoming just another case in a high-tech operating room?
That's a valid concern, and it's something we as surgeons need to be very conscious of. MIS should never be about prioritizing technology over the patient. The patient's well-being, their fears, and their expectations should always be at the forefront of our minds.
So it's not just about the technical aspects of the surgery, it's also about the patient's experience, their emotional and psychological well-being.
Absolutely. We need to make sure patients, understand the procedure, feel comfortable with the technology, and are actively involved in the decision-making process.
So building trust and open communication between the surgeon and patient seem more crucial than ever in this age of high-tech surgery.
I couldn't agree more. And that's where organizations like TORG play such a vital role.
Yeah.
By advocating for patient-centered care and promoting ethical practices in MIS. TORG is helping ensure that the technology serves the patient, not the other way around.
It's reassuring to know that there are organizations like TORG working to keep the patient at the heart of all these surgical advancements.
Yes. And TORG also plays a crucial role in addressing the global disparities in access to MIS. We've talked about the cost of technology, but there are also significant disparities in training and expertise.
You're right. Not all parts of the world have equal access to the latest advancements in MIS, and that can create significant inequalities in healthcare.
Absolutely.
What are some of the challenges in bridging this gap?
Well, one of the biggest challenges is the lack of infrastructure and resources in many parts of the world. Building state-of-the-art operating rooms equipped with the latest technology requires significant investment.
Right.
And then, there's the challenge of training surgeons and support staff
Yeah.
in these specialized techniques.
It's a multifaceted issue that requires a multi-pronged approach. It's not just about providing the technology.
Right.
It's about building capacity,
Yes.
creating sustainable systems that can support the adoption and implementation of MIS.
Exactly. And that's where global collaboration is so important. Organizations like TORG are working to foster partnerships between, institutions in developed and developing countries, sharing knowledge, expertise, and resources to help bridge that gap in access to MIS.
It's inspiring to see this kind of global effort to make these life-changing advancements available to everyone.
Yes, and TORG is also involved in advocating for policies that support the equitable distribution of MIS technology and training.
So it's not just about the technical aspects, it's also about addressing the broader societal and economic factors
Absolutely.
that contribute to these disparities.
You've hit the nail on the head. It's
Yeah.
about recognizing that access to healthcare, including access to the latest surgical advancements, is a fundamental human right.
That's a powerful statement. And it really highlights the ethical dimension of MIS. It's not just about the technology. It's about ensuring that technology is used to promote, justice and equity in healthcare.
Absolutely. And that requires a commitment to ethical practices, transparency, and accountability throughout the entire healthcare system. It's about ensuring that these powerful tools are used responsibly and for the benefit of all patients.
It's a reminder that progress in healthcare shouldn't come at the expense of ethical principles.
Precisely. And that's why organizations like TORG are so crucial in setting standards, promoting best practices, and advocating for ethical considerations in the adoption and implementation of MIS.
TORG's role as a global advocate for ethical and equitable surgical care is truly commendable. It's heartening to see organizations like TORG working to ensure that advancements in surgery, like MIS, benefit all of humanity.
As we wrap up this part of our deep dive, what key takeaways should our listeners keep in mind?
Well, I think the most important takeaway is that MIS is a transformative force in surgery, but it's not just about the technology. It's about a commitment to patient-centered care, minimizing trauma, and maximizing recovery. And it's about ensuring that these advancements are accessible to all patients, regardless of where they live or their economic circumstances.
It's a reminder that healthcare innovation should be driven by a deep respect for human dignity and a commitment to the well-being of all people.
Exactly. And that requires collaboration, innovation, and a shared vision for a future where surgery is as minimally invasive as possible, accessible to all, and guided by ethical principles. We'll be back after a short break to explore the future of MIS and delve into some of the most exciting developments on the horizon. Welcome back to the Operating Room Global. We've been on quite a journey exploring the evolution of minimally invasive surgery and its impact on patient care.
It's been great. Fascinating to delve into the intricacies of MIS, from its groundbreaking technologies to the ethical considerations surrounding its implementation.
Before the break, you painted such a vivid picture of AI,
Yeah.
assisting surgeons in real time and natural orifices becoming like surgical entry points. It's clear that MIS is rapidly pushing those boundaries.
Yeah.
What's possible in surgery? What other exciting advancements are on the horizon?
Well, one area that holds immense potential is the development of biocompatible and biodegradable implants.
Okay.
Imagine implants that dissolve naturally over time, eliminating the need for a second surgery for removal.
That would be incredible. So
Oh.
less invasive surgery and no need for additional procedures.
Right.
That's a win-win for patients. What else is in the pipeline?
Another exciting development is the use of focused ultrasound for non-invasive surgery. This technique uses high-intensity sound waves to target and destroy tumors or other tissue abnormalities without any incisions.
So it's like surgery without the surgery.
Yeah.
What are the potential applications for this technology?
Focused ultrasound is already being used for treating certain types of tumors, like uterine fibroids and prostate cancer.
Right.
And ongoing research is exploring its potential for treating other conditions, like brain tumors and essential tremor.
It sounds like science fiction becoming reality.
Right.
With all these incredible advancements, it's hard to imagine what the future holds for MIS. What are your thoughts on where this field is headed?
I believe we're only at the beginning
Wow.
of the MIS revolution. As technology continues to advance, we can expect to see even more minimally invasive techniques and applications emerge. Imagine a future where surgery becomes virtually scarless, pain-free, and incredibly precise.
That's incredible.
Yeah.
It's a really exciting prospect.
Yeah.
But I imagine there will always be new challenges to overcome.
Of course. I mean, as we develop more sophisticated technologies and techniques, we need to ensure that they are, safe, effective, and accessible to all patients.
Right. That brings us back to the importance of organizations like TORG
Yes.
in advocating for ethical and equitable access to surgical care worldwide.
Absolutely. TORG plays a critical role in promoting those best practices, ensuring that advancements in MIS are implemented responsibly with the patient's best interest in mind.
We've covered a lot of ground in this deep dive into minimally invasive surgery. As we wrap up, what are some key takeaways you'd like our listeners to remember?
I think the most important takeaway is that MIS is not just about the technology.
Right.
It's about a philosophy of patient-centered care, minimizing trauma and maximizing recovery. It's about using innovation to improve lives and making surgery as seamless as possible for patients.
It's been an incredible journey, exploring the past, present, and future of MIS. And it's clear that this field is poised to transform the surgical landscape. for generations to come.
It's an exciting time to be involved in MIS.
Yeah.
I'm really optimistic about the future.
Absolutely. We want to thank our listeners for joining us on this deep dive into minimally invasive surgery. If you're interested in learning more about MIS or the work of TORG, please visit our website at website address.
And don't forget to subscribe to our podcast for more insightful explorations into the world of surgery.
Until next time, stay curious, stay informed, and stay engaged in the global conversation about healthcare.
Goodbye, everyone.
Goodbye.